have a fairly traditional family medicine model. I see infants from the time that they're born through end-of-life care and everything in between. I graduated from residency in 2003, so I've been in private practice since that time. The thing that's different about what we do is that we have a real focus on prevention and looking for the root of illness in our patients. So we don't try to just say, oh, well, today your blood pressure is high, now you have hypertension, here are the 5 medicines that I like for hypertension. It's, wow, your blood pressure is starting to creep up. What's going on in your life that might be driving your blood pressure up? There are many factors that could be involved in that. It could be that you're under a lot of stress, and so your fight and flight nervous system is going too hard, so we need to work on ways to modulate and modify that and bring your blood pressure down. It may be that the way you're eating is causing some central weight gain and that's putting pressure on your cardiovascular system, so we need to figure out why you're eating the way you're eating and how we can change that to help you lose that weight so you can get back down into a normal blood pressure. The thing that I really like is I love getting to know people, to figure out what are all the different factors that are running under the surface. Not just, oh, I'm really sick of the weight that I have on my body, but wow, when did you start gaining weight? When did your weight really balloon? What's going on with you? How does your gut feel? How does your body feel? What other things might have been going on at the start of that illness? And being kind of a health detective is very exciting to me. I love the challenge of figuring out the thing that we can remove or replace that the patient needs that isn't just a prescription. When I pull out the prescription pad, I feel like I've failed. Sometimes I have to, sometimes things are going on that we just can't figure it out or we can't make that change in the patient's life. And then yes, I can prescribe and I do prescribe, but I feel like, I wish we could have done this a different way. You come into my office and I say, well, which function isn't working? Is it your digestive function? Is it your absorptive function? Are you inflamed because you're eating a food you're allergic to? For the doctor to get to where the connection is going to take longer than 8 minutes. It takes a real conversation, a real digging into the problem, rather than oh, you said you're having reflux. I have a pill for reflux. Boom. Oh, you're not sleeping at night. There's a pill for that. Boom. Rather than, oh, wow, reflux and insomnia, both of those could be stress related. What's going on in your life that might be causing you stress? So in my practice, recognizing that patients are complex, I've worked really hard to keep my overhead as low as I can to allow me the time to see fewer patients so that I can take the time that patients really need to actually figure out what's going on and explain to them my thinking. I see this, this, and this. To me, these relate in this way, and I know these 4 biochemical facts that undergird that. And I try to make sure that they understand why I'm recommending this particular form of exercise or this particular vitamin or this particular diet so that they feel completely involved and bought into the progress we need to make together to get them back to optimal health.